All right, welcome everyone to our Take Action webinar. We are so excited that you're here with us today. Our topic today is neurodiversity and nuance. What a pleasure it is that we get a chance to come around together with a breadth of professionals as well as two fantastic people with lived experience who are really going to help us understand this topic even better. And I think one of the things I know as a pediatrician is that oftentimes we just do not know nearly enough about this great world that is represented in so many diverse ways. And so I am delighted to have this group with us today. Our objectives for our talk and our time are really to help us understand and recognize various perspectives that relate to neurodiversity, identify specific strategies to serve individualized goals with the interdisciplinary teams that many of us either work on or have had experience being cared for or with them. And then also develop a plan for intervention that includes best practices concerning individual interests and long-term outcomes. One of the things that I'm so passionate about is really making sure that anyone that walks in the space alongside me, whether that be other professionals, whether that be patients of mine, whether that be just people in my community, is that they are respected and loved and seen for the possibilities within all of their abilities. Here at Echo Autism Communities, that's really what we're all about. So seeing the possibility in all abilities. And I think today is going to take us even further into that space so that we can really learn more about what that means and not just saying it, right? So really learn more. So I'm going to introduce our speakers. I'm thrilled to have this group with us. Many of them are part of our Echo Autism Early Intervention team, but we also have a fantastic guest speaker with us. So Haley Moss was diagnosed with autism at age 3 and made international headlines for becoming the first documented openly autistic attorney admitted to the Florida State Bar. She received her Juris Doctorate from the University of Miami School of Law in 2018 and graduated from the University of Florida in 2015 with a bachelor's degree in psychology and criminology. Haley is a renowned visual pop artist and the author of Middle School, The Stuff Nobody Tells You About, and a freshman survival guide for college students with autism spectrum disorders, The Stuff Nobody Tells You About there as well. She also illustrated and contributed to the anthology, What Every Autistic Girl Wishes Her Parents Knew. Her writing about autism, neurodiversity, and disability has appeared in publications such as The Washington Post, The HuffPost, Teen Vogue, Fast Company, Mike, Bustle, and others. Haley also co-hosts the Spectrumly Speaking podcast, which is dedicated to women on the autism spectrum. Haley has been featured in major media such as The Today Show, Forbes, CNN, USA Today, Yahoo, People, just to name a couple. She currently serves as the Florida Bar Young Lawyers Division Board of Governors and the Constituency Board of the University of Miami Nova Southeastern University Center for Autism and Related Disorders, and the Board of Directors for Different Brains. Again, what a delight it is to have Haley with us. We have others that are with us as well that I'm so proud to have them serving as content experts, again, on our Echo Autism Early Intervention team, which really focuses on how do we move best practices, which include working to really help both kids and their parents and caregivers and society think about people on the spectrum and with all sorts of other abilities as they move and as they work and learn to be the best folks that they can be. So Brett Moore is a pediatrician and father of a 6-year-old son with autism. Being both a physician and a parent of a child with autism gives him a unique perspective on evaluating children with autism and helping their families. He is currently involved in several ECHO or Extension for Community Healthcare Outcomes autism programs, helping families, implementers, and providers all around the country. He's also the medical director of the University of Missouri's General Pediatrics practice, so we're very happy that he is with us. Brittany Stevenson is an occupational therapist. She's been working at the University of Missouri and the Thompson Center for over 9 years. Brittany has served as a member of the Echo Autism Early Intervention Hub team since it started in 2019. She also teaches at the University of Missouri's Graduate Occupational Therapy program. Michelle Damp is a speech language pathologist with extensive experience evaluating and treating children with a concern of autism spectrum disorder, and she participates in interdisciplinary evaluations and provides intervention for patients with autism and various speech language disorders at the University of Missouri. Michelle also provides graduate student instruction for students in the University of Missouri Speech, Language, and Hearing Sciences program, and is a member, of course, of the Echo Autism Early Intervention Hub team since its inception in 2019. Michelle Hanem is an early childhood special education teacher. She has worked for the Columbia Public School program, the early childhood special education program here in Missouri, for over 15 years, serving many distinct roles, including classroom teacher, itinerant teacher, behavior specialist, case manager, and trainer for both teachers and parents. She has been part of the Echo Autism Early Intervention Hub team since 2019. All right, and last but certainly not least, we have Laura Barnes, who is a board certified behavior analyst and licensed behavior analyst in the state of Missouri. For the last 15 years, she has worked to ensure that ABA services are accessible for children, adolescents, and adults with autism spectrum disorders and other developmental disabilities. She also works hand in hand with their caregivers, teachers, and support staff to make sure that they can succeed and thrive in their environments and really foster all of those abilities that they are able to have already. She has extensive experience in designing programs to target the acquisition of essential skills and the reduction of behaviors that are negatively impacting the individual across a variety of settings, including working in center-based clinics, in-home services, residential programs, and in-school settings. Laura strives to ensure that every client can make meaningful progress toward achieving their individual goals while improving the overall quality of life for the entire family. So I am, again, so thrilled to be part of this team. We are going to have a presentation that really goes into what neurodiversity is. We're going to talk about ableism. We're going to talk about ABA. We're going to talk about all sorts of things today, and I think it's going to be a really meaningful opportunity. We also have time for questions and answers towards the tail end, and we are looking forward to all of our learning. So I'm going to turn it over to the group, and we're going to get started. Thank you.
Hey, hi everyone, this is Michelle Dam. We are going to get started with our Neurodiversity and Nuance webinar today, and we are so excited to have Haley with us as our guest speaker. I think you're going to learn quite a bit through all of the information that you're provided with today. So our learning objectives, we just want you to be able to understand the concept and definition of neurodiversity, also recognizing the various perspectives related to neurodiversity, and then how would you go about developing that plan to include best practices and demonstrating respect to individual interests and long-term outcomes. So as far as the definitions, there are quite a few words that we may be using today that you may or may not be familiar with. So for neurodiversity, we're looking at that diversity of human minds. The neurodiversity movement is considered to be a social justice movement that seeks civil rights, equality, respect, and full societal inclusion for everyone, including neurodivergent. I included the new sign, the neurodiversity sign, on this page, and then also the definition of neurodivergent, a brain that functions in ways that diverge significant from the societal standards of normal.
We also wanted to lay out there a few concepts that might be new to folks. So how we use language and the words we use are really important. And so these are two common ways that people tend to talk about other people. So an example of person first language, and this is kind of an older way, it's been around for a while, but that would be putting the person before the disability or the condition if you were talking about someone. And the thought behind that is that you're emphasizing the person and not the condition. So an example of that would be Brittany has an autism spectrum disorder. That would be talking about me and my disorder in a person first way. Another way that is a little newer would be identity first or disability first. So people who prefer this really feel like a condition would be a crucial part of their identity and you shouldn't separate it out from them, and that using person first language really denies their real identity. And so an example of talking about someone with identity first language would be using autistic. Brittany is autistic, she's an autistic individual. So those are just two main ways that are out there. There are lots of variations of that, but we wanted to introduce that in case that was new information to you. Also wanted to introduce some models that are out there when we think about disability. A really common one would be the medical model. And if you work in healthcare, this is probably pretty familiar, and that would be focusing on an impairment or a diagnosis at, need some kind of intervention because it's something that's needing fixing or it's broken. So that medical model really focuses on what interventions can we make available to fix this thing that we see as a problem. And I'd like to introduce to you the social model, which is a little different than that. And the social model looks at the world more as society being the barrier and not necessarily the disability or condition itself. And so social model views disability as that's part of being human, that we all, if you don't already have a disability or condition, will. And it's more important that society has community-based supports and opportunities and inclusion to support all of us. So it's less focused on this one person. So you can see kind of in the picture, there's your little person and they're surrounded by a society full of barriers. And there's some examples of barriers there. It could be people's attitudes or prejudices. And Haley's going to talk to us about ableism. It could be the built environment itself not being accessible, or even just, organizations having really rigid policies around the way they do things and certain practices that are not helpful to all of us. So just to emphasize, hopefully those of you who are watching, a lot of you may be in health professions, and I believe we have kind of a power that we abuse sometimes in the way that we talk about people, and we influence culture a lot by the way we label people and categorize people and decide who fits where. And a lot of us have different points of views, and out there in the world outside of healthcare, people have lots of different points of view. So we hope today that we can really highlight for you some of those different points of view.
Okay, so now we're going to turn it over to Haley.
All right, thank you so much. And it's great having that nice introduction to all of that stuff in definition. So even when we're talking about language and we're talking about models of disability, kind of going off more of what Brittany said as well, is that there is no right answer. So you're probably thinking, do I use person first? Do I use identity first? So kind of circling back to this idea of best practices, which is something that we're really trying to address today, is if you can, take a good listen at how somebody describes themselves, or if you don't know, just ask how they might describe themselves. You probably will hear me throughout the day refer to myself as autistic, because I don't think autism is something I could take with me. And I don't think you should need to be reminded that I am a person above everything else. We are all human, and sometimes being reminded that maybe you have to be reminded that I'm a person doesn't always feel too comfortable. I can't separate being autistic from the fact that I am a woman, or that I have red hair, or just who I am as a human being. And it's just as much as part of me as being a woman or somebody with red hair or anything in that matter. So kind of going off that, and I always appreciate that medical versus social model, and understand that there is no one correct answer, kind of going off of what Brittany said as well. So you might feel a little bit of both, especially for our self-advocates in the room or that are around, is that it would be really great if you are autistic and you had less anxiety. Anxiety would be very nice to be able to alleviate, and that might not be a societal thing all the time. But it would also be nice if we got rid of the things in society that made that anxiety or meltdown prone kind of existence better. So there's always somewhere in the middle, I think, of everything, or that we could borrow something from each perspective that we talk about in order to understand what's going on best and how we could best help as many people as possible. So when we're understanding this idea of neurodiversity and what it is, a little bit of this history of it. So the really cool thing with neurodiversity is it actually started with autistic people, and it started with a sociologist in Australia by the name of Judy Singer. Judy Singer is autistic herself, and you first heard this word because right after Judy Singer was writing her thesis, she was in communication with a journalist at The Atlantic by the name of Harvey Bloom. And Harvey Bloom wrote about neurodiversity as a concept for the very first time in a 1998 edition of The Atlantic. And I actually put a quote on a later slide from that article to help explain neurodiversity more. And when we're trying to understand neurodiversity, we also think about people who are neurotypical and who are neurodivergent. So you heard this idea of neurodivergence earlier. We will dive in a little bit deeper of who actually is neurodivergent. And the majority brain that we have is neurotypical people. So people who might not have a condition or some kind of acquired condition either, or disability that may make them neurodivergent. So when we're talking about all kinds of brains, neurodiversity puts everybody together. So we have our neurotypical and neurodivergent people. Together, we are a neurodiverse group. No one individual is diverse, but they can be divergent. So as we've seen, this term kind of evolves over time. And when we talk about neurodiversity as a term, what I really want to kind of bring home to you is it's not just a synonym for autism acceptance. Neurodiversity covers a lot of people. And so does the movement. That the neurodiversity movement also covers this large swath of people. That's not just people who are autistic. We also have people who have intellectual disabilities, people with learning disabilities, ADHD, people who might have mental health or psychiatric disabilities, or people who are at the intersections of multiple of these things. As we know, a lot of autistic people may also have mental health or psychiatric disabilities, or may also have a learning disability, an intellectual disability, or even ADHD. So kind of understanding that neurodiversity is very intersectional. And when we talk about reducing stigma and prioritizing us as humans and having a diverse society that meets all kinds of minds, it also involves all kinds of bodies, all kinds of people who think differently, and also all aspects of our identities go into this. And I think when we talk about social justice more broadly, that's something we really need to think about, is that it's not just one version of autism. It's not just one version of neurodivergence, and how each person experiences neurodivergence is very different. So I am a white woman. How I perceive and experience being autistic is very different than that of my peers who are marginalized by race, who are marginalized by sexual orientation or gender identity. And is also very different than how a man who is either marginalized in these ways or other ways experiences the world. So I think it's really important that when we talk about self-advocacy and neurodiversity, we understand that it really does cover a lot of different people, and that we really are aiming for that respect and understanding, that inclusion, that nothing about us without us moxie that you so often hear in disability rights more broadly. And something really important to understand about neurodiversity is there's a huge misconception that goes around that people who believe in neurodiversity, especially autistic people, see autism as this quirky superpower thing. And that's just it, that neurodiversity is somehow for these quote unquote higher functioning people. First off, that's just not true. Second of all, I do not refer to myself as high functioning, end quote, end quote. Autism is actually seen as both difference and disability. Nobody is denying that autism can be very hard, especially if you have more support needs or are more visibly or profoundly disabled. What we're trying to say is that this is not something that is a freak of nature type thing. It is a normal part of human existence. We all experience the world differently. Our brains work differently. That autism isn't something that needs to be eradicated or dealt with in this horrible negative way, that we see people that are different than us. That's just part of being human. It's part of that human spectrum as a difference. It's also disabling for many different reasons, whether drawing from medical model, social model, or something else more in the middle. There are many different models of disability, and medical and social model are just one way of simplifying it. We also have a really cool thing that is autistic culture. So you might have heard that there's deaf culture, and that there is a whole way that capital D deaf people may interact with one another and refer to themselves. So while not all of, some of us can be deaf actually, because again, disability is very intersectional, but autistic culture is very distinct, that we stim, that we share memes, that we have a different way that we communicate with each other. And I know even from having other autistic and neurodivergent friends, the way that we communicate and the level of social rules that are somehow non-existent is very different. And it's a lot like speaking another language and having a different culture. And it makes me feel like I'm at home a lot, is understanding we are all people who think differently, who experience the world differently, and have had the world somehow tell us be yourself, but not like that to some extent as well. So it's really important to understand there is some beauty in this neurodiversity too, even though you might not always see it because it might be new to you, or you might not understand, but there really is a culture, and it's important to respect that. And sometimes as neurotypicals, the best thing that you can do is just observe that it might not be your place to enter those autistic spaces. I have recently been asking for kind of an informal survey, and also because I'm writing a piece on autistic representation in TV and pop culture, and I asked only autistic people to comment. You would be shocked how many neurotypical people have entered that space that I created to say how they feel. And sometimes that's just not appropriate to butt into an autistic cultural space, or when it's asked that we have self-advocate input. that as parents, as professionals, I know you mean well and you want to learn from autistic people too. But sometimes you have to know when there's a boundary that's being set. If I say I want to hear from autistic people about this, it doesn't mean that I want to hear from you as a parent about this either. It's kind of frustrating. It's kind of awkward, but it's something that I think that we all deal with, is being treated fairly, respectfully, and also seeing that we are different, but it isn't the worst thing that's ever going to happen to us. The worst thing that's ever going to happen to us is actually a far more common experience, and especially for those of you in health professions, this might be very familiar, and that is ableism. It's something that happens to all sorts of people with disabilities, not just autistic people. And I really like this definition from the Center for Disability Rights on ableism, and we're going to take a little bit of time to unpack this. I'm going to read it, and sentence by sentence, we're actually going to go through it. So ableism is a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities, and often rests on the assumption that disabled people need to be fixed in one form or the other. Let's back up there. That's basically saying that ableism is really much rooted in the medical model with that idea of fix and cure. And that's something that we expect as kind of a norm and to be expected of disabled people, and that we should be doing. Sometimes the reaction that you get when you tell people you're autistic is, I'm so sorry. Other times people ask if you have tried a certain intervention in your life, even as an adult. Oh, have you tried eating this? Have you tried this program? Have you tried that? And it's like, but what if we're actually happy with who we are and we don't need to be fixed in order to have a successful or happy life? Moving on, ableism is intertwined in our culture due to the many limiting beliefs about what disability does or does not mean, how non-disabled people learn to treat people with disabilities, and how we are often not included at the table for key decisions. So there's lots of things about what does disability mean. People think it has to be visible, that it has to impact them as well as the person we're talking about. So disability is actually a very broad spectrum. About 1 in 4 Americans is a person with a disability. And I always like to give the legal definition of disability, which comes from the Americans with Disabilities Act. And that's that a disability is a physical or mental impairment that limits one or more major life activities. And people go, what does that even mean? Basically, if you have a physical or mental condition that limits something that we do or take for granted every single day, like a major life activity might be thinking or concentrating or walking or learning or communicating, all of these different things are considered major life activities. That's a pretty broad definition. So a lot of us are considered disabled there. Non-disabled people learn to treat disability as a scary thing, that it's something to be feared. Think about when we talk about disability with young children. What is the message that we often send them? We often tell them, don't stare and don't ask questions. We are already taught to treat it from something to be feared and something rooted in pity. And finally, we're often not included at the table for key decisions. Think about even today, it is a huge privilege for me to be here. And it shouldn't be an afterthought to have disabled people at the table, especially in our own conversation that we're so often excluded from. And we should also be seen as key decision makers at our own table. We shouldn't have to make a new table in order to be included, nor should we have to be constantly excluded from the currently existing table. Is when we talk about disability rights, there's an old phrase, nothing about us without us. And I think it's really important that we echo that when we talk about ableism more broadly. And it is very intertwined in our culture. So there are things that might be inaccessible because you are trying to adapt to a world that doesn't always have you in mind. And I always like to talk about, as a self-advocate, like, why do we even do this? Sometimes it's exhausting. We do a lot of emotional labor and we do a lot of labor on behalf of educating neurotypical people and non-disabled people. And for me, everybody needs to be accessible, accepting of all kinds of minds, and the world needs to be neurodiverse and accessible, and realize that people with disabilities are indeed our future. We are always around, we've always existed, and everything should be enjoyed by anyone who wants to participate in this webinar, in our communities, in employment, whatever it may be, should have the opportunity to do so. And not just have that opportunity, but have the support they need in order to get there. We can place a job in the middle of the screen right here if I wanted to. And some people will have a very easy time seeing that or being able to access the opportunity, while others would need more support to get there. Just because it's in the middle of this gray box, basically, with no physical barriers that we can see, doesn't mean that everyone has the same chance to have that opportunity. So it's important that we actually give everybody what they need in order to achieve that goal or that something. So making sure that our future is accessible is really an important piece of neurodiversity and also dismantling ableist systems within our society. Which brings us to more about neurodiversity. So we talked about what is neurodiversity, and here's kind of a more extended definition that I wanted to give because we kind of scratched the surface earlier today, is that neurodiversity is a concept where neurological differences are to be recognized and respected, as is any other human variation. So our neurodivergent populations and differences can include autism, ADHD, learning disabilities, Tourette syndrome, acquired brain differences like traumatic brain injuries, Alzheimer's and dementia, intellectual disabilities, and mental health disabilities. There's a lot of people who are neurodivergent. And going back to our discussion of Harvey Bloom as well, is that neurodiversity may be as crucial for the human race as biodiversity is for life in general. And who can say what form of wiring will prove best at any given moment? I think this really does encapsulate what neurodiversity is about, in that we really do need different types of approaches to solving problems, different types of approaches to experiencing the world in order to prove what may be best at any given moment. Is that sometimes we need all kinds of minds. Most of the time we need all kinds of minds.
Thank you so much, Haley. That was so much just amazing information. Next, we're going to go to Dr. Brett Moore, and Dr. Kristen Soul gave a great introduction at the beginning. So we'll go ahead and go on to his first slide talking about being a parent of a child with autism.
Thanks, Michelle. As Michelle said and Dr. Soul said, my name is Brett Moore. I am a parent of a 6-year-old. He is autistic and he's getting ready to turn 7. So it's he's excited about his birthday coming up. And I'm also a pediatrician as well. And so I'm going to talk about kind of being both, being a parent and being a pediatrician. And so a lot of what I'm putting in here, the first part is kind of my philosophy or my thoughts on being either or, because that kind of drives what I end up doing, decisions that I've made or will make. And so I thought that was kind of important to put in the beginning. So, and as a parent, I feel like of all the things that I do in my life, being a son, being a brother, being a husband, although being a husband is very important as well, I feel like being a parent is probably my most important job. And in that, you have to be adaptable. There's thoughts that I feel like I should be doing, and I always have to adjust and change those as time goes on and manage those expectations. Expectations as a parent are put on me, and anybody that have children know this, they're put on you by everything. There's my self expectations that my children think I should be doing, that my parents think I should be doing, that society thinks I need to do, everybody, all those expectations. And as a parent, trying to manage those expectations. And I'm constantly looking for ways to improve. I don't have all the answers as a parent. No one has all the answers. We all are trying to do the best we can, and then always trying to look for ways to improve. So the things that I say that I do here, that doesn't mean that they are the right ways to do it. There are no, I feel like right ways to do almost everything. So it's always something that I'm looking to ways to improve. And this is what I quote unquote put as my job as a parent. And this again is subjectively speaking. There's no objective data on here for those people that look at data. This is just what I feel like I should be doing. Number one, first and foremost, I feel like I need to love my child and love my child unconditionally. It doesn't matter what's going on in their life, but I am here to love them. I'm here to also protect my child. So protection, especially in the beginning of life, looks different than protection as the child becomes an adolescent versus protection for the child as they become more of a young adult. But I feel like that is part of my job. Number three, I need to prepare my child for the future. So I have 2 other children that are older that do not have autism, and I still feel like the goals are all the same for all of them. I want to make sure that I can do whatever I can to prepare them for independent living, if that's kind of, hopefully that's what they would like to do, is do things on their own. So prepare them for that, being able to make decisions for themselves. So hopefully I can give them that knowledge, they can do things for themselves and make those decisions for themselves, and then advocate for themselves. I need to be able to give them opportunities to explore in the world so that they can gain those new experiences to help make decisions as life goes on. And then hopefully help them to enjoy life to the fullest. And this is going to look different for every child. What makes my oldest happy does not necessarily make my middle child happy, and sometimes they butt heads because of that. But you know, that's what I'm here to do. I'm here to help them enjoy life to the fullest. So this is kind of the talk on being a parent and having an autistic child, and what kind of my thoughts are with that. My goals for Noah, because that's my youngest, are the same for all of my children. Even though the goals are the same, the journey is going to be different. So what I do for one is not going to work for the other. And this journey just looks a little different, I guess, compared to the other two. Doesn't make it bad, it just makes it different. I have to learn to confront my own bias and my own expectations of what my child should be. I think every parent likely goes through this whenever there's a diagnosis of autism that is received. We have expectations of what we feel like our children should be, whether that is child should be an athlete, or the child should be great at school, or whatever. So I have to work on that, because having a child that has autism, you know, what my child should be, it changed. And whether it should or should not, it just did, because that is how I felt whenever he received the diagnosis. I was talking with Dr. Soul about this right after the diagnosis was received. And I felt like there was, something had changed. Nothing changed with him. And he's an awesome kid, but I had to learn to change my own bias on what my thoughts were. And so sometimes change can be hard for us. But I had to learn to confront my own biases and change my expectations. And then I felt like, I need to do whatever I can to help my child be the best that he can be, and help him to gain independence later on. I felt like there are things that I needed to do. And so we looked at what to do. And we felt the best thing is to start on therapies to help him acquire skills so that he can lead the best life that he can. And this is to help improve communication, improve independence, as well as improve quality of life. And whenever we were looking into therapies, I'm going to talk about ABA a little bit. I know Laura's going to talk about ABA more in a little bit as well. But I felt ABA as a benefit and not a detriment, even looking back. I know there have been a lot of talks recently about how ABA, whether it's good or bad, whether it's needed or not needed. Every person's different, every child's different, so every situation and scenario is going to be different. And I felt like for my child, it was definitely a benefit. He was diagnosed at 21 months, and at that point in time, he could not talk. Even though some kids can't talk, they can still communicate their wants and their needs by other ways. Communication isn't just being verbal, but he was very limited in the ways that he could communicate. And so we had to work on finding ways that he could communicate until he could talk and express his wants and his needs verbally. And for options we had with ABA, ABA was mostly discrete trials at first. If you know anything about ABA, you probably know that ABA can be very different depending on the child that's receiving it. There's different ways of doing ABA. And the question is always, what is the best? And again, that can be very, very subjective at times. But what we first started off were the mostly discrete trials. Basically, you put out, an example would be putting out 3 stars. There's blue, red, and green. You say, touch the green star. And if he didn't do it, then they would do it for him. And you keep doing that until he starts doing it on his own. Usually you have some sort of a reward system. That's discrete trials. That's fine for some things, and that's fine for some people, but that didn't work the best for Noah. So we had to find ways, we had to research and trial and error and modify until we decided one thing that was going to work best for him. And for us, it was a type called ESDM, and that's where you kind of work with him versus just having him do stuff. You see what he likes and enjoys, and you use that as a springboard then to try to help him do other things. So looking back, we talk about ABA as what it does for the patient as a doctor, or as for my child as a parent. But I mean, selfishly, I guess I've looked at ABA and what it has given myself and my wife. To us, it helped us to know and understand our son better, because I think that as a parent, that's what we all want. We want to be able to understand what our children want and need and to help them. It helped us give hope, because whenever your child can't communicate what they want, you want to do whatever you can to get them to that point where they can help themselves. And the hope that we had, it was great to have that feeling like we were going to be able to see him do things that he wants to do. And the peace of mind that hopefully he can start to advocate for himself earlier on. And then what ABA gave to Noah, it gave him opportunities in life, we feel like, and not less. We don't feel like it took away from his personality, because I never want to take away from his personality. I want Noah to be Noah. And I felt like this gave him opportunities to do that. It gave him a voice, not only, with his voice, but also by other means to be able to communicate. And, that's priceless, to be able to see that and be able to know those things. And then we were able to see him enjoy life more afterwards, because he was able to do the things that he was wanting to do that he wasn't able to communicate before. And so being able to see him discover life in a new way was amazing. And I felt like ABA was able to do that. So then switching over and wearing my other hat as a physician, again, kind of saying my philosophies. And again, these are my thoughts of what I feel like the philosophies are. As a physician, most people feel like, and it is true, we do this as well, we're here to prevent disease and illness and treat this whenever it does occur. So everybody thinks of a doctor as, oh, you're sick, you go to the doctor. Here, you have an ear infection. Here's some antibiotics, treat that. So, there's a disease or an illness, and we're trying to, quote unquote, cure it or fix it. Very typically, that's what we end up doing in a lot of the sick visits that we see. But that's not all that we do or all that we should do. We also try to help identify those that need assistance, provide guidance for the families for what is best care. So if you have a child and you've had a well child check, we don't just ask questions about, are they sick? We ask, what are they doing? How are they doing? You need to watch for this because they're going to start learning to climb. So make sure that you're kind of getting everything safe for them as they start moving around. So providing guidance for families and for parents, discussing options on ways to help improve quality of life. And again, just kind of guiding families towards, what they feel like is best for their family. So working with and for patients. So the autism community and their family is no different. We should be doing the same thing with them as we do with any other family, and that is working with them. It's important to listen and learn as well as teach, because I feel like as a doctor, part of what I do is teaching. It's probably one of the reasons I went into being a doctor and a physician as a practice, because I like to talk. Sometimes I talk a little too much and I ramble, and I apologize to my wife a lot for that as well. But so I do a lot of teaching as a doctor, but just as important as it is to teach, it's important to listen as well as learn, because it's not something that's static. Medicine is not static. It doesn't stand still. It's always changing. It's always evolving. And I learn from what other doctors are doing, but I also learn from families. Maybe how do I help families differently or better? And so I have to stay up to date to both benefit the patients and their families. And again, I think it's really important to stress that I am working with families. I hope I don't. I'm sure I probably have told people what to do. Usually I help them along by saying, these are options. What are your thoughts? Hopefully I'm working with families. I'm here to offer knowledge. So some of that knowledge comes from diagnosis. So whether that, again, is a medical condition or not, I'm here to offer that knowledge of, I think this is what's going on. This is likely what we have. And then offer knowledge on how do we help. And a lot of times when we're talking about things like autism or disabilities, there's therapies that are involved. And I have to give my knowledge on, I feel like these therapies would be appropriate And I have to give definitions sometimes for some families if they're not sure what that therapy is. And this includes physical therapy, occupational therapy, speech and language therapy, and then ABA therapy, again, which we'll talk about a little bit later as well. Or any other kind of services that are around. That is what I'm not here to tell them you need to do this, but I'm here to say these are the things that help. Let's talk about what you guys would like to do.
Hi, yeah, thanks. My name is Michelle Lanham. Again, as introduced earlier, I'm an early childhood special education teacher. Worked for Columbia Public Schools for over 15 years in the special education department. And, I say I've been a teacher for over 15 years, but my mom would tell you I've been a teacher since I was 2.5 when my baby sister came home, and I kind of took over being a teacher then, or at least a mother hen. And so that's definitely kind of what led me down the path of being a teacher. And I kind of fell into that special education realm, and it's just kind of my niche. I've always been a person that tries to lift people up and help them meet their goals and dreams. And that's kind of where I kind of feel like teachers are. And just a little bit of a perspective from a special education teacher. I'm working preschool, so I work with children that are generally 3 to 5-year-olds. And yes, as Laura was saying, that there has been so many changes over the last few decades, just in life in general. There are things that were done 50 plus years ago that are not done anymore, where kids were put in institutions or definitely segregated away from everybody else. And I feel like the big thing is, our big push is everybody together. Inclusion is that big piece. However, in the school setting, we are still evaluating our kids because of deficits and concerns, delays that they have. And we were talking about, kind of that difference between the medical and the social model. And I feel like education is right in the middle of all of that. Yes, we still are evaluating because of concerns and putting things in place. But I kind of feel like we are kind of somewhere in between of it. We know that we're not going to fix it, but we definitely are trying to put things in place to help them be the best version of themselves they can be. When we do evaluate children, and if they are qualifying, we always want to consider that least restrictive environment. And when we're really thinking about that, we want to make sure that we aren't being too restrictive, that we're making sure that we're just giving them just enough to make sure that they can be successful. And that can look like a lot of different things. And just like Laura was saying earlier, all of these things need to be done on an individual basis, and they need to grow and change over time. That a plan that we make today may be good for, a few months or maybe a couple of years, but we need to evaluate and keep moving through and changing as needed, especially as the teacher and the group changes around them. I kind of feel like as teachers, our biggest job is to really help give them those tools and skills to make sure that we are helping them be those productive members of society that we all are hoping that we all can be ourselves. I keep saying when I grow up, I'm going to be a really good productive member of society. So even though, most would judge me as not having a disability, I still feel like there's those pieces where we all need to learn and grow. And as teachers, that's a big thing for me. That you need to continue to keep yourself educated, making sure that you're staying up on things, making sure that we are using best practices. That's a wonderful thing about being able to be part of this ECHO team, that we're able to kind of get all of those pieces out to everybody. And where I'm going with all of that is that it's really important that we have those high expectations for those kids. It doesn't matter what their concerns or disability or level of divergency can be on that piece, that making sure that we find where those children's interests and strengths are, and that we can help teach through those weaknesses. And I kind of feel like in a school setting, that's really kind of what we're doing as teachers. We make sure that we're doing things, different teaching strategies and different teaching styles to help making sure that we hit all the different learning styles that there are. Sometimes it needs to be a hand-on activity. Some kids learn best by talking through something. Some kids need to see somebody do it a couple of times before they're ready to take on that activity. And really knowing that sometimes, since all of us learn differently, we need those opportunities as adults as well. And so taking the opportunities, as Laura was saying, to grow as individuals and listening to all their different perspectives really empowers us to give that same opportunities to our students, to our children, to all of those that are around us. Because in a world where we're all together, we can all work and learn together, because every day that I'm in a classroom, I'm learning something. Even if I'm the teacher, I am still able to be that student as well. And that's kind of the world that we're kind of really, I think, trying to strive to become, where we're all together and we can all work and learn and benefit from everybody. So again, it's really hard. I know the school setting sometimes kind of gets a bad rep at times, because we're looking at kids with their deficits and their concerns, but we really are, I feel like the school setting is really working really hard to change those pieces and building up those students and coming out with those best things. And again, I'm working with really young children, so as they get older, to keep them involved and having them be part of that piece is definitely awesome. But as a new 3-year-old that may have very limited skills, that process gets to be really difficult. As they get older and they get all of those skills that they need, those pieces then become more available to them. So again, as a teacher, I think our job really is to meet every child where they're at and give them the amount of supports they need to reach their full potential.
Awesome. Thank you, Michelle. Next, Brittany and I worked together on our slides to talk about that neurodiversity perspective while doing our therapies and interventions. What we feel is important to make sure that we're including the neurodiversity movement and also providing really good interventions is taking into account the human dignity, just being very goal-oriented, making sure that we're including our kiddos, we're including our parents, we're setting goals that that are appropriate and that they're wanting to strive for, not just what we think they need to strive for. So asking the family, what is your goal? I recently had a family who had a daughter who is in high school. And in my head, I'm always, looking for independence and employability, but their goal for her was to be happy at home. They did not have any expectation for her to be employed. They just wanted her to be happy at home, which I had to kind of change my way of thinking, because that's not fair for me to impose what I'm wanting for her. I need to do what the family wants for her. So then we had to rethink our goal set, which was perfectly fine. And it was a very big learning experience for me. Make sure, that we're working with our interdisciplinary team so that everybody is on the same page, working with all individuals that we're working with, all families that we're working with. We're communicating with pediatricians, teachers, other interventionists, and then also helping that family to be able to advocate for their child, and eventually helping the child to advocate for themselves so that they can say what they want and they can ask for what they want and need. We just want to make sure that we're being very respectful of that within our therapies. So one visual that was put into my head, and I really liked it, was taking that definition of neurodiversity and respect for everybody and our interventions and kind of, locking them together so that we're respecting those individual differences. And we work with our patients and families to recognize that neurodiversity, there's definitely some differences that need to be respected and considered, and everything doesn't need to be fixed. No one is normal. There's all different levels of that. So just really taking into account, what that patient and family want through the interventions, and then really promoting those self-advocacy skills, bringing our kiddos into their IEP meetings, starting around 2nd or 3rd grade, so they can start advocating for what they want and what helps them in the classroom and all of that good stuff. So as interventionists, what is our goal? Keeping in mind neurodiversity, we want to make sure to accommodate and support our students, patients, and their families, respect, understand, and support through intervention, and be careful that we're not trying to cure or fix an individual. Here are some references that I put on the end of our webinar, so feel free to check some of those out. And that is the end of our webinar. So I will stop our share right now.
Excellent. Thank you guys so much for sharing your expertise. What a fantastic opportunity. Yes, we just covered a ton of content, but I think that our time together discussing some things now will be really, really well well utilized. I think when I listen to each of you sharing your perspectives, to me, it's a wonderful opportunity that we have right here to be thinking through how do we advance the issues around neurodiversity. And certainly one of the things that I think came out of each of your discussions was that really important piece of keeping it front of mind. And so I'd like to start first with Haley, if that's okay, and asking Haley, when we're talking about neurodiversity, we're talking about ableism and these various issues. And certainly I know you know this, and I definitely know this, but wow, it's kind of everywhere. So how do we help to how do we help our colleagues as well as just everyone in our communities better understand both ableism and the need for neurodiversity?
Okay, there's a lot to unpack here.
I know, sorry.
It's okay. Please don't apologize. So I think first off is kind of taking stock of yourself and your own life. So every single one of us has biases. We stereotype, and that doesn't mean that we're bad people. It means that we do this because it's human nature. So unlearning the ableism that we've been taught or that's intertwined in our culture is a first step before we start educating other people. I know this from my own lived experience too, is there are still things that I am trying to unlearn very actively. And I think about what's ingrained into our culture that we don't even think twice about. For me, that is the prevalence of the word crazy. I know this sounds like the easiest thing in the world that you're like, oh my gosh. It is something that I've realized as time goes on, and by listening to enough neurodivergent people with mental health conditions and psychiatric disabilities, that the word crazy is very harmful. What do? Do I just apologize every time I say it? I could. And then and then you hope you get a free pass for saying it. Or you can say, okay, this is hurting my friends. This is hurting my colleagues. What can I say instead? If you have heard me trying to break this habit, you have probably heard me say things like bonkers, ridiculous, or just wild. You've heard me say some other kind of word. And that is something that I do to challenge myself in order to unlearn the ableism of harmful language. As we have learned over time, language changes a lot. We've talked about identity and person-first language. We've seen this huge push to get rid of the R word. Things like that are very kind of just ingrained ableism. So that's easy stuff to unlearn and something you could do very tangibly. And then, of course, there's who you are when the autistic and neurodivergent people you love are not around. Are you correcting them or saying, hey, this is really hurtful? When somebody says something that you're like, I can't believe you just said the R word. And there are times I have to still do this with friends because they still have it learned in them because they went to school back in 10, 20 years ago where this was very normal and it was an insult, haha, funny. And then, of course, it's very harmful to a whole group of people. So I think language is probably one of the easiest forms of ableism to clean up. As far as neurodiversity in our discussion of ableism, and ableism, of course, is much bigger than language. I just use that as my kind of default example for people because it's something very tangible that you can immediately understand. The kind of ableism that I deal with the most is the hardest stuff to untangle for most people. And I don't mean to take too much time on this topic, but one of the hardest things for me to untangle, and I think as professionals, you all and parents, you all really have to re-examine your feelings on this one, is this idea of benevolent ableism. And that could be a whole webinar in of itself. But the easiest way to explain benevolent ableism is that you are making decisions without that and offering help or assistance when it is neither wanted nor needed. And what that ends up doing is it strips us of self-advocacy, it strips us of independence, and doesn't allow us to be participants in our own lives. This is something that happens a lot with friends more than anybody else in my life or people who know me socially. Is imagine that after our webinar today, we are all going to have a pizza party. Just imagine all of us are going to go to a pizza party together. All of us who are currently presenting, all of you who are listening to us today. Well, we have one friend here. Let's just say it's you, Kristen. Let's just say we have one friend here who doesn't like pizza. Kristen is our friend who absolutely hates pizza. Oh, she's looking at me like, I can't believe you just said that. But for example's sake of benevolent ableism, Kristen is our friend who hates pizza. So what are we going to do? Benevolent ableism is that we're just not going to invite Kristen. And Kristen is going to one day call us out on this and go, why didn't you guys invite me to the pizza party? And me, being the considerate, nice friend, who is mistaken in this is going to say, well, Kristen, I know that you don't like pizza and I didn't want to make you uncomfortable. So I thought you just wouldn't want to go. But of course, Kristen wants to go because she wants to hang out with all of us, right? Like, of course she does. And me saying we didn't invite you because you didn't want to go, we thought you just don't like pizza, kind of takes that decision away from her. Maybe she would have wanted to join us and she would have ordered something else off the menu at the pizza place, or she would have had a snack beforehand, or she just wouldn't, or she would have found something else that would have made her happy, but she really just wanted to be with the group. This is something that happens to us a lot, is that help when it's neither wanted nor needed. She probably wanted to make the decision whether or not she wanted to hang out with us on her own. And if she said, no, thank you, I don't like pizza, I don't want to go, that still puts her in that driver's seat. That is the thing that a lot of us need to unlearn, because we're really trying to help the people we love. And sometimes our intentions are really, really good, but we're also hurting people by not letting them self-advocate at that same time. So that's the thing that I really, really want you to take stock of, especially with neurodivergent and autistic people, is this idea of benevolent ableism. More so than cleaning up your language or anything like that, it's because benevolent ableism is the thing that most of us are guilty of in some way, shape, or form. Even when you see someone with a wheelchair who's expertly folding it up into their car and you think that you have to help them because that poor person in a wheelchair, and they have it down to a science and they say, no, thanks, I got this. Take that cue. Like, this is something that's not just for autistic and neurodivergent people. It's something that all of us kind of struggle with because we are taught a certain way to interact and we think we're doing the right thing. And sometimes we're just not.
That was so well said. And I loved your examples. Thank you for that. That was very, very helpful. And I think there's so much for us to relearn, unlearn, all of those things. They're so, so important. And I loved a theme I really heard coming from all of you today was the theme of really listening, learning, and then I would add also embracing each other, right? So really learning what it means for us to kind of go about our own spaces. And as somebody who I regularly share with people, I have anxiety, pretty decent anxiety. And so certainly, that's something that's really tough. And people don't necessarily know that about me, but it can be tough, right? It can be really tough to stress and to worry. And it's a minor thing compared to some of the issues that we're talking about today. But at the same time, my brain thinks differently than other people's. And that's okay. And that's something that I think is so important for all of us to really embrace. And I love that you guys each touched on that. So in thinking a little bit about, so piggybacking off of that question that I asked Haley, but I really want to ask and engage all of you in thinking about how do we ensure that there's a place for all autistic people in this neurodiversity movement? Now, this is a little bit of a packed question, right? So really what I'm thinking about here are the issues related to people who have more of a non-speaking voice, right? So we know that there are lots of people who have, they're called all sorts of things, right? Minimally verbal, non-verbal, all this stuff. What I'm speaking about here, though, how do we make sure that we have a space for them and for their needs and what they would like to have in their world? How do we do that as professionals, and then obviously again as community members? And so why don't we start first with Michelle, and then we'll kind of go round robin, because I think this is an important topic.
So this is a tough question, because whenever you have a child who has difficulty with communication, a lot of times mom and dad or caregivers are making those decisions and therapist is giving input into that, right? So that's kind of how we've been doing it. I think, just taking all of this neurodiversity and the differences into account, we have to be looking more at what is the child interested in? What are those preferences? We have to look towards, those advocacy. That child may be advocating for themselves in a nonverbal way. And so being able to read that and move forward with that, but also taking the expertise of the therapist and the knowledge of the parents and putting it all together. So I think it's a big deal. It's a big situation, but it's so important.
Great, thank you. All right, Laura, I'm going to have you go next, and then we'll kind of, like I said, kind of continue to go around. I'm really interested in how we think about this. It's something it's really important to me.
Yeah, it's a really important question, and I think a really important topic too. I think my response is going to be similar to what Michelle just said. Assessing preference. There are ways that we can do this in ABA that we, do a preference assessment, look at what the person is interested in, and try to use those things as much as possible in therapy. Aside from that, teaching the individual to communicate their wants and needs, how to, even things as simple as like making choices and including that in treatment, so that they can down the road become better self-advocates and express the things that they want and need more clearly with the people who maybe aren't able to as quickly understand what they're trying to say as maybe mom and dad might say. Because we all know that, mom and dad are great advocates, but our preferences change. If we were to ask my mom what my favorite meal is or my favorite snack, she might say something that's completely off base because it was 20 years ago. But preferences change, and continuing to assess those over time and to incorporate those, not just, once a month, but every single day. What are you interested in today? What sounds good today? And again, incorporating as many opportunities to make choice and to speak for yourself as possible.
Excellent. Thank you. That's super helpful. And I think, this is part of what I think about when I think about self-reflection and looking at it is, what I'm about to say isn't necessarily analyzing your own biases, but it's reflecting on how you like to make those types of decisions for yourself. And then how can you then in turn foster that in the people who you are around, right? And I think that as a parent, those are really important things we have to think about as just a regular, again, member of society. I think those are all so, so important because I find myself thinking about my own kids and thinking about as they get older, how important it is for me to start to move toward or move away. It depends on how you want to look at it, right? But how we really move towards helping them make their own decisions, but not us making those decisions for them, and being okay with the decisions that they make for themselves and for their lives. And I think that it's such an important thing. And I see a lot of parents as a pediatrician, and I see a lot of parents struggle with this, whether their child has a disability or not. And frankly, it's something that as somebody who loves to help parents parent, then that's an important thing I think we all have to think through is how do we make that transition from, early childhood parenting to even, elementary school parenting. And then that changes a lot as we become our own person in middle school and high school and past high school. Those are really important things for us to be thinking about. So thank you for those really important steps. So, okay, as just to frame that question back up again, thinking about how do we make sure there's space for all of us, and specifically for those who may not have as much verbal, ways of communicating, but making sure that their voice is still there. So Haley, I'm going to send that one to you next.
Okay, this is actually such a great question. And I think when we talk about neurodiversity and the neurodiversity movement, it's very important to understand that with any social justice movement, we center the most marginalized people, and that is often our non-speakers. So neurodiversity is not just for people who are seen as quote unquote high functioning or very talkative or verbal. I think that's something that gets misconstrued a lot by professionals and by parents. That everybody has the right to a self-determined life. Everybody should have access to ways to communicate and to self-advocate. So kind of going off of what Michelle and Laura were saying, as well as that behavior is communication and that everybody should have tools to communicate. So whether this is a child who's using an AAC device like an iPad or an app, or they're using a letterboard or facilitated communication, whatever they may be, we have to respect that voice. So I was a non-speaking kid. Most of my communication was crying, screaming, and pointing. That doesn't mean that I wasn't telling you what I wanted. We just have to get very adept at meeting children where they are. And it doesn't mean, and I think this goes a lot, and I think we always forget this when it comes to non-speakers and intellectual disability in particular, is not speaking is not the same as nothing to say. Let me repeat that. Non-speaking is not the same as nothing to say. There are many times that we will sit silently when things make us uncomfortable or something like that, and we don't say anything, or we just don't know how to get the words out, or there might not be a word for what we're thinking and feeling. So I think that's a really important piece to kind of keep in mind when we're having this discussion, is that we make sure that whatever we're doing is making sure that we listen to that person's voice and that we're giving them opportunities within reason but also maybe a gentle challenge in the right direction to be more independent, to feel comfortable and safe and valid in their identities and voicing their opinion. I think with young neurodivergent people in particular, is building that identity is something that we need to do. And I think that professionals sometimes miss the mark on, is that we're telling people how to act in a largely neurotypical world, and we're not teaching neurotypicals how to act in with other people. Not that this is a neurodivergent world, but a neurodiverse world for that matter, because we're not all the same. And that's a good thing. We're better for it. I think we have to kind of keep that in mind as we have this discussion. So I guess what I'm trying to say is, please center the voices of non-speakers, try to seek them out. And the only voices that are not there, so I know we have a lot of parents who will say there are their child's voice, you're advocating with them. I think that was such a powerful thing that was brought up here earlier by a lot of the professionals, as we're advocating with people, not for them. And I think we need to keep that in mind as we keep going as well. So we're advocating with people, we're not their voices. It's our job to make sure that their voices don't go silenced or unheard.
Yeah, so powerful. Thank you very much. That's so powerful. Okay, so Brett, I'm going to come to you in a same question, just a slight twist on that question. So thinking about your role as a parent and thinking about how do you make sure that you are fostering Noah's self-determination and self-advocacy skills, even though he's 6, almost 7, how do you think about making sure that not only is his voice being, heard, but also that the people around him, whether that be teachers, therapists, doctors, are making sure that they keep his, interests and his, real abilities and all the things that he wants to be able to do at the forefront. So how do you think about that?
I really wish that my wife was here for this question, because she is amazing at this stuff. She blows me away. It's that advocate, being the advocate for him. I think it's something that we have to be very present for whenever we're having conversations with, with the school and with the teachers. We're always having to make sure that we are advocating for him and with him. He isn't to the point yet where he can be in those IEP meetings. And so we have to make sure that we listen to everything they're saying. And like I said, we have to be very present. So we know that teachers, as with everybody, they're going to have their own notions of what they feel like is going to work best. And we have to make sure that from our experiences with Noah through, prior to him being verbal and now being verbal, that we use those experiences and know what his preferences are, that we can then advocate for him, so that even though he is not present at those meetings, he is still present through what we have been able to learn from him and continue to. And that's the other thing, is that continual learning process, the adaptation of what's going on, I think is also very important, because it's not stagnant, it doesn't stand still. We have to make sure that we're constantly changing. As we see him change, we also have to make that change until he can sit at the table with us and start advocating for himself. And I hope we make the right decisions until we get to that point. I worry about what our kids are going to tell their psychologists when they get older. You just always worry. Ever since Jen was pregnant with Jacob, our first one, I have not stopped worrying. It's just constant, and I continue to. And I hope that we have been making those right decisions. And I hope that fear of us making mistakes continues to push us to make the right decisions for him and to continue to learn. And again, it's that advocating for him until we can advocate with him when he's there with us.
Awesome. Thank you. All right. So I'm going to move us along just a little bit into some of our kind of other topics and thinking about intervention. So intervention, right? When we think about the meaning of that word, it means intervening on something, which implies there's something to be addressed. And so I think that, I'm going to go there with this topic because I think it's a really important topic for us to talk about. It is true that ABA therapy has deep roots in quality research and lots of work that's been done. And I think that just like we've all been talking about, we know that a lot of learning has been made, a lot of learning has been had. And certainly as we try to figure out what do we do in the integration of our autistic colleagues, as well as our autistic patients. In my case, I'm a pediatrician. But as we think about that and we hear their voices and we listen to their voices, then how do we continue to make sure that all of the work that has been, I'm using this word very carefully, done for the autistic community, how do we make sure that we don't lose ground in the intervention space? And how do we help to make sure that we are making sure that the autistic voice is clear? And again, the full meal deal of the voice, right? So I know that was a loaded statement with a few questions. So I will bring back around to the actual questions. But when we're talking about intervention, what do we think about intervention in the light of developing a human being's potential to live their best lives? Now, again, that's thinking about what does it mean to live your best life? What do they want in that space? And then also, what is our role in that developing of that, that self-determination is really what I'm thinking about. So yes, there's been tons and tons of stuff going on in the news and in the autism circles about ABA and other types of intervention. So I'm going to start with Laura. And so as a BCBA, help us better understand how you see the best practices around integrating the lived experience voice, not just the parent, but the lived experience voice in the work that you do.
Absolutely. And so I just appreciate the opportunity to talk about this, because I think it's something that oftentimes is a little bit one-sided. I mean, I don't see a lot of BCBAs speaking up about ABA. And again, not to discredit anything that's been said or done, but, and again, feel free to redirect me and get me back on track here. But I think it is one of the things that you said really kind of spoke to me. And it's this idea that people can continue to access this. I think since I've been in the field for a while now, I've been a BCBA for 12 years. And I think it's something that was always kind of lingering there in the background, but has really kind of come up recently, this anti-ABA movement. And it's a little heartbreaking to me. I think it's just scary for me too, to think that there are families that could really benefit from ABA who may be scared of it now based on some of the experiences that they've heard and perspectives that they've heard, and haven't even reached out to talk to a BCBA. And I think that's one of the things that I always try to incorporate, as far as even from day one, when I get a referral and I talk to a family, I'm sure to talk to them specifically about what they see as barriers and what they could use our help with, or our expertise. My expertise is how to change behavior, how to, whether it's, looking at a barrier that may be interfering with the ability for this individual to have a more meaningful experience in this realm, whether it's developing friendships or being able to address, communication deficits, or working on vocational skills, and, pretty much you name it, and we can probably find some way to work on it with ABA. But just because, like Michelle mentioned earlier, just because I think it's an important goal, it doesn't mean that it is an important goal for them. And so getting, the caregiver's perspective on what they see as barriers, talking to the individual if they have the ability to do so, about, what's most important to them, and getting their assent throughout therapy. If I have a protocol or a recommendation that might be, something that's new to them, I want to make sure that the parent and the individual signing off on, us implementing this thing. And I also want to make sure that they are learning it as well. And so my goal is always to teach myself out of a job. I want the caregivers to be able to, implement these things when I'm not there. And I think a lot of times it can be kind of intimidating, and I won't speak for parents, but I think that it can be difficult for them to bring up, because I'm the expert on behavior analysis. I'm not the expert on your child or on what's important for you. And so I really need to hear, from the people receiving the therapy, how I can serve them, how I can help them reach these goals, and how I can do it in a way that works for their family and for them and for their individual situation. So yeah, that's my perspective on it. And I think, yeah, speaking up if you do have questions or concerns, or if you have a little bit of an icky feeling or aren't sure about what this thing is or why we're doing it or how it plays into those bigger roles. I really want my families to know that this is ask me questions. If you have any questions, talk to me about it. Sit in on therapy. Let me know what you like and what you don't like. Because if you don't like something, you're not going to implement it when I'm not there, and that defeats the purpose. And so, yeah, I could ramble about this for a long time. But
No, it's great. I really appreciate your thoughts on it. And I know we could have, honestly, we could probably have an entire series on this topic alone. Not that just, but I mean the neurodiversity, the nuance, I have so many other questions I want to ask you. So I know we're kind of coming to a close here, and I want to have a few opportunities for each of you to tell us what you think. If you had a magic wand, that's my favorite kind of question, the magic wand question, what would you want people to know about neurodiversity or your experience in your own growth and development related to better understanding a neurodiverse world? So I'm going to go to Michelle Hanem first, and then we'll kind of go around, and I'll hopefully let you know as we get closer to who's going to go next. But let's go with Michelle Hanem first.
You do really like to ask loaded questions.
I do.
I wish we all had magic wands, but we don't, or that magic globe to kind of see everything. Oh my gosh, that is such a loaded question. I feel so nervous to try to even begin to start to answer that question. But I think just looking at my role and my job and things that I've done in school-based, if I'm talking specifically school-based, working with 3 to 5 year olds, it really is, I want them to have that voice and learning how they can effectively communicate to others, because I kind of feel like that's the biggest thing. Like we're always trying to get whatever our wants and needs are met at all times. Like all of us right now, whether it is me kind of moving around in my chair, like trying to get comfortable, knowing how I can get those needs met. And especially, my work has been with 3 to 5 year olds. And so a lot of them, their bodies are doing things or not doing things, and they don't know even basically what they need or what they can do to get those needs met. So I definitely kind of feel like trying to help them learn those pieces and giving them the opportunities to practice different things for them to find something that will help them. So again, that looks a lot of different ways for a lot of different kids. And I think that's from a teacher's perspective, try to teach in so many different ways. And so I think that's a big thing, is being able to give our children as many experiences in as many different ways possible for them to have those learning opportunities, because you might be able to find, and I, as a teacher, as a trainer myself, I'm always telling others and myself that we have to be detectives, because that's our job, is to watch what's going on around us. And I think that's one of the best ways to kind of learn. I think we've all kind of talked about that we have to do that listening and watching. We're always really kid driven. And so really taking the time to watch, to see what our kids are doing, to see how they react, to see how they learn best, and then being able to implement those pieces more often. And I think that those are the pieces from home to school to share back and forth. So if we're seeing something that's working at school, to be able to share that at home, so that those can be the building blocks of those next pieces. So I'm not sure if it's a magic wand, but definitely want to be able to help, give those supports where possible for them to become, those people are, they can activate and they can talk for themselves and get their own wants and needs met, I think is like the biggest thing for, for them to be happy in life.
Yeah, I love it. Thank you so much. Okay, next person to get the magic wand question. Let's go to Brett. Brett, what would you, I know everybody loves my magic wand questions. So the magic wand question, just in case anybody has forgotten what it is essentially, you can take a couple spins on this if you want to, but what would you want people to know about neurodiversity if you had a magic wand, and what would you hope would change in our world? So I kind of tightened up that question a little bit better.
First of all, I wish you would just throw softballs at us instead of giving us these other.
Then that wouldn't be any fun, and who would learn?
Not for you. Why not? As far as what I would want, the magic wand, people to know neurodiversity is not a negative thing. Neurodiversity is a positive thing. the phrase, the variety is the spice of life, right? I don't like spicy food, but in life I'm okay with it. It helps. Differences are incredible. It's what makes life interesting. And so I want people to know that it is a positive. It is not a negative. And what I would like to see change in the world is that you don't get all those negative experiences because of that. People think, and it's true, you hear these negative things about autism and all this kind of, it's hard as a parent to see, because not only does it affect my youngest, but it affects my other children too. And, just to give a short example, one of my children was on playing a game and was talking to somebody, and that other kid used the R word and really upset him. And so he said something to stick up for neurodiversity, and the other person continued to be very mean and negative. And it was just what he went through was awful to see. I'm so glad that he stuck up for neurodiversity. But it's that negativity is so hard. And that's what I would like to see. I would like to see that disappear and see it for the positive that it is.
Very well said. All right, Michelle Damp, if you'll go next.
Okay. So with my magic wand, I would want people to know that neurodiversity is not scary. To me, it is a very delicate topic, but it's not scary. And to not be afraid, basically be brave enough to ask the questions and be brave enough to find out about it. And I think the more people that get educated about all the aspects of this neurodiversity topic, I feel like that alone is going to help to change the world for the positive.
Love it. I agree. All right, Laura, you're next.
All right, so with my magic wand, coming at it from the perspective of a BCBA, so I think that big picture wise, with my magic wand, I would want everybody to be able to talk and listen to each other and learn from each other. I think that's how, not just specific to neurodiversity, but I think in the world as a whole, it would benefit a lot of people. And so I think this lesson kind of narrowed down to neurodiversity and ABA and everything else. That's really my wish, is for people to have the courage to have these hard discussions, and not just have them, but also hear what the other people are saying and apply it so we can change our behavior. Thinking back to where the clinician I was 10 years ago versus the clinician I am now, we're very different in our approaches and how we might, work on a particular treatment and approach a client. And I think, the same could be said for our field and for the field of ABA. Where they were 50 years ago is not where they are now, and will not be where we are in another 50 years. And so I think giving people the opportunity to listen and grow and change is something that every human being deserves and should be able to do. We should be able to grow and learn from each other and work together and have these conversations in a respectful manner, and to learn from each other. So that's my magic wand wish.
I love it. That's awesome. I'm going to share with you my magic wand before we go to Haley to round us out on this magic wand question and our time together. So my magic wand is that every single person on this whole entire planet would have a chance, would open their minds enough to see themselves in a neurodiverse way. I think sometimes what happens is we get so much of them versus, it's like the others kind of situation, and it gets so frustrating because who decided? Who was the, gold standard way of thinking, right? Like that's kind of, when you think about it, that is almost the antithesis of quote unquote normal, right? So I mean, if everybody is like, thinks in one way, and they're thinking that only their way is the way, that's kind of got its own issues if you really think about it, right? And so my wish, my magic wand would be that everyone would take a look at themselves and figure out how it is that they bring uniqueness to this world and how they think is unique in this world. And then the offshoot of that would obviously be so that no matter who you are, you can feel like you belong. And I think that's obviously in the role that I have as a pediatrician, and then also obviously working with many people across the spectrum, on the spectrum, off the spectrum, and all over the place. It's such a beautiful honor to get to see people's uniquenesses. And it hurts so bad when people are just absolutely, left out because they have a different way of thinking about something, and it's just not acceptable. And so when I think about the ways that I hope our world will evolve and change, I really do hope that it's all about how we can each see our own uniquenesses fitting into that space, the whole space, right? It's such an unfortunate thing that we feel like we have to judge each other for all sorts of things, but also the way that we think or the way that we act. And so hopefully, as time goes on and conversations like today's continue, we'll have that opportunity to see people thinking a little bit more broadly about what makes us who we are. I think that's a really important thing for what we do. And so that's my magic wand. And Haley, I am really excited to hear what your thoughts are about this question. And also, if you want to, go ahead and leave us with additional thoughts that you'd like us to make sure we know.
Oh my gosh, I feel like I'm going to have the most idealistic version of this magic wand question. So I'm going to start with what I hope would change in our world. And if I had the magic wand, if I had the magic wand, we would not be having this conversation whatsoever. That we would be so inclusive and so accessible that this would be such a waste of time to have spent the last, say, what is it, hour and a half or 2 hours together talking about what neurodiversity is and isn't and why we need it. Oh my gosh, that would be my perfect world, is we don't have to have this conversation, that we would literally be out of business and that I would not have to do the work that I do, because we are so inclusive and so accessible and so understanding that this is irrelevant. Unfortunately, I don't think we're there. But as far as what I want people to know about neurodiversity, I want people to be less afraid, which has been echoed here so many times. And I think that people really need to do better at listening to and engaging with autistic people as stakeholders in our own conversation. So much of the focus, as we know, is parents and professionals. We love you guys, but also please make sure that you pay attention to what the autistic community is saying. A lot of our criticisms have roots that are valid, whether it's in history or lived experience or trauma or just wanting the same thing. And I think something that gets lost in this nuance that I really want to send us home with is all of us are here for the exact same reason. Whether or not we agree, because I will be very honest, there are plenty of things that my fellow panelists and presenters have said today that makes me feel uncomfortable or I disagree with, and that's okay. But all of us are here because we have the same goal, and that's because we want autistic kids and their families to be happy, well-adjusted humans who have opportunities for access and inclusion. That's why all of us are here. We all just have different ways of how we think that should be achieved. So that being said, I hope that you listen to a variety of different voices. You listen to voices who aren't just the panelists here today. I don't want to be your token autistic person that you listen to. Please listen to people who are autistic, who have different experiences than I do, who have different experiences than our panelists, and families who have different experiences in them. So I think that this is a great jumping off point for you to learn more about different options that you may have. There might be an approach that works different for you or better for you. So I don't have the same experience. I was not an ABA kid. It's not something that worked for us or that we even considered. I was a developmental approach. So I was speech, OT, SLPs, all that good stuff. In DIR floor time, I was a happy adjusted kid. I think I became a reasonably happy, well-adjusted adult. So I like to kind of throw that out there because I know there's probably some self-advocate who is watching and going, well, what do you think? So I just want to kind of address that really quickly. But yes, my perfect magic wand world is that we are so accepting, so inclusive, and very aware and not just tolerant, but really active accomplices in being inclusive and really doing our part to dismantle ableism and enjoy living in a diverse and neurodiverse world. Thank you.
Yeah, that was so well said. And I think that we have to keep learning. So one of my favorite phrases is embracing curiosity, right? Because I think sometimes we don't get super curious about things. And I think today that was exactly what we were hoping to do, was try to help other people embrace curiosity and really embrace, and not in like a hokey kind of way, right? But like say, hey, help me understand how you see this, because it might be different than how I see it. How do we think about things in different ways and different approaches? So it's certainly something that I take so seriously. I learn from so again, I'm a pediatrician, so I'm going to call them patients, but I learn from my patients every single visit. And it's the most amazing experience, because I literally leave my clinic days like thinking about so many neat things in so many different ways because of those experiences. And so I hope that we each can have the opportunity to stop, to listen, and then truly learn from the people that are around us, because I think there's so many things that we can be able to do when we do those simple, basic, elemental steps of listening and learning and truly being open to that. So I thank you guys so much for your time. Haley, especially, really appreciate you joining us today. It's such an honor to get a chance to officially meet you, and also hope that we have many, many more opportunities to learn from you and learn from your network, because you're right. Your perspective is your perspective. And I very much value it. And yet I also want to make sure that we are always thinking about having people with autism, autistic people, whomever, whatever it is that they want to be called, at the table. And so that's something that's super important. And at Echo Autism Communities, that's where we strive to do in every single step of all of the work that we do, is to absolutely be as inclusive. But we know that we can always continue to work hard on that. And so I thank you guys each for your time, obviously your leadership and all of the different walks that you have, the hats that you wear, and the people that you enjoy your life's journey with. So we will look forward to having more conversations. Again, I think we could go for a long time on this topic, but we will bid you all adieu for now and look forward to seeing you all next time. Thank you guys so much.